Hey everyone, welcome back. Today, we're going to be taking a deep dive into preventing falls
Oh, yeah.
in hospitalized older adults,
Absolutely.
especially those dealing with dementia and frailty.
Right.
You know, it's a pretty serious issue,
Oh, it is for sure.
considering that almost 1 in 3 adults over 65 fall each year.
Yeah,
So get ready to arm yourselves with some practical tips for better patient management.
definitely.
We're going to be looking at a few recent research articles,
Okay.
a systematic review of falls, risk of frail patients with dementia in hospital, progress, challenges, and recommendations,
Mm-hmm.
hospital falls, clinical practice guidelines,
That's good.
a global analysis and systematic review,
Okay.
and practices of falls risk assessment and prevention in acute hospital settings,
Yeah.
a realist investigation.
Yeah, those are some great articles.
Yeah, they are. So
Yeah.
what do you think are some of the most important takeaways?
Well, I think the first one, that systematic review, it really dives into how dementia, frailty, and falls, they're all connected. It's kind of like a vicious cycle.
It is. You know, we know dementia can cause things like orthostatic hypotension,
Oh, yeah.
like that lightheadedness when you stand up,
Exactly.
and it can cause all sorts of gait disorders.
Mm-hmm.
And these issues, of course, make falls way more likely.
Exactly. And then every time someone falls, it can make their frailty worse,
Right.
which makes them even more likely to fall again.
It's like a domino effect.
It is a domino effect, yeah.
Got to stop it.
Yeah, we got to figure out how to break that cycle.
Exactly. And speaking of things we got to watch for,
Yeah.
that review talked about gait speed as like a potential 6th vital sign.
That's right. Yeah, it might seem a little strange at first.
Yeah.
But experts like Fritz and Lusardi have been talking about this for a while.
Okay.
And the World Guidelines for Falls Prevention and Management actually recommend we should measure gait speed.
Interesting.
Yeah, think about it. Like, if someone's walking really slow,
Yeah.
like, it takes them more than a few seconds to walk just a few meters. That could be a sign that something's wrong.
Yeah. I mean, that makes sense. So, like, if you're doing your rounds,
Right.
just taking a quick look at how fast someone's walking.
Right. And maybe even timing them
Yeah.
could give you some really valuable info.
Yeah. That's something we can all start doing right away.
Yeah, absolutely.
So ideally, we'd have, full-on gait analysis in every single clinical setting.
Of course. Yeah, that would be great.
But there are some challenges, right?
Yeah, there are some challenges.
What
There's
they?
still no, standardized method that everyone agrees on.
Oh, I see.
And some of the more, high-tech stuff, like
Mhm.
wearable sensors,
Yeah.
those can be pretty expensive.
Yeah, that makes sense. Not exactly practical for every hospital,
No.
but, there are other things that we can do.
Right.
That systematic review, it talked about how effective structured interdisciplinary bedside rounds can be.
Cyber. Yeah.
Cyber in reducing fall.
Mm-hmm.
So what do you think is so great about cyber?
Well, I think the best part is that it brings the whole care team together.
Oh,
Like the doctors,
Yeah.
the nurses, therapists, everyone.
right there at the bedside.
Right. Right to the patient's bedside to talk about the care plan.
Okay.
And that includes, of course, fall prevention strategies.
Mm-hmm.
And I think that direct communication, it really makes a difference.
Yeah, and I feel like it also helps everyone feel like they're part of the solution.
Yeah, that shared responsibility, that's key.
Yeah, for sure. And does it actually work?
It does. There was a study done at Sydney University Hospital.
Okay.
They saw a big drop in falls after they started doing cyber.
That's really encouraging.
Yeah, it is.
But even with a system like that in place, we got to remember to involve the families too, right?
Oh, absolutely. Families play such a big role.
Yeah.
And it's interesting, that study about cyber,
Hmm.
they actually found that family involvement kind of went down over time.
Oh, wow.
So we need to figure out how to keep families involved,
Yeah, we need to find ways to, educate them and empower them
Right.
so they can be real partners in fall prevention.
Absolutely.
Now, while SBI focuses on a collaborative approach,
Yeah.
the Hospital Falls Clinical Practice Guidelines Review,
Mm-hmm.
which analyzed 20 guidelines from all around the world,
Wow.
it really stressed how important comprehensive falls risk assessments are.
Yeah, that's a big takeaway. There's global consensus on that.
But there wasn't total agreement on when we should be doing those assessments, right?
All right. Exactly.
So tell me about that.
Well, some guidelines say we should be assessing every older patient,
Okay.
or any patient after they've had a fall,
Mm-hmm.
or if their medical condition has changed significantly.
Okay.
But then others say we should only be focusing on the patients who are already considered high risk.
So there's some room for interpretation there,
Yeah, for sure.
which makes sense.
Right.
Because, every hospital has different kinds of patients and different resources.
Exactly. You got to adapt to your specific situation.
For sure. Now, our third article, Practices of Falls Risk Assessment and Prevention.
Yeah.
That one was focused on the UK's National Health Service.
Right.
And it really highlighted the importance of multifactorial falls risk assessment, or MFRA. So can you tell me more about what that is?
Yeah. So MFRA basically means looking at the whole picture, you know? Like we don't just focus on one risk factor.
Right, because falls are rarely caused by just one thing.
Exactly. We need to look at the whole patient and their environment.
Our whole context.
Right. Exactly.
And that study, it also talked about how important it is to individualize interventions.
Yes, absolutely.
So like a one-size-fits-all approach isn't going to cut it.
Not at all.
We got to tailor our strategies to each patient.
Yeah, cookie cutter approach, it just won't be as effective.
Now that study also highlighted something that I think we've all probably felt at some point.
Okay, what's that?
Like sometimes just relying on assessment tools, it can feel a little bit limiting.
Yeah, I know what you mean.
Like we're just going through the motions.
Right.
Instead of like really trying to understand what the patient needs.
Yeah, sometimes those assessments, they feel more like checking boxes than actually getting to the heart of the matter.
Right, and that study found that the process of doing a thorough assessment combined with your own clinical judgment, that's actually what matters the most.
That's good to hear.
Yeah, it means our expertise and our experience still really matters.
It does, it does.
So what about technology?
Okay.
How does health information technology, or HIT, factor into all of this?
So HIT, it can be a double-edged sword, you know?
Okay.
On the one hand, it can help us a lot. Like it can make documentation more efficient. It can generate alerts for patients who are high risk.
Right.
And there's even software that can personalize interventions.
Oh, wow.
There's one called Fall to PS that does that.
So it can automate some of our tasks and keep us organized.
Exactly.
But there are downsides, right?
Yeah, there are. On the other hand, implementing HIT can be expensive.
Yeah.
The systems can be complex and you have to train your staff.
Right.
There's a risk of just adding more work for everyone.
Yeah, so it's all about using technology in a smart way.
Right.
Finding that balance between the benefits and the risks.
Exactly.
Now, speaking of systems and structures, this study also brought up the importance of leadership in creating a culture of fall prevention.
Yeah, that's huge.
It's about making sure everyone feels responsible for keeping patients safe.
Absolutely. Preventing falls, it's got to be a team effort.
In that study, it specifically mentioned having dedicated falls leaders or champions in the hospital.
Falls champions,
So what do these champions actually do?
Well, they're like the advocates for doing things the right way.
Okay.
They're pushing for evidence-based approaches. They're making sure staff are properly trained.
Right.
And they're making sure that everyone feels like they can contribute, you know?
So they're not just about identifying risks. They're about building a whole culture of prevention.
Right. Exactly.
They're helping make fall prevention something that's always on everyone's mind.
Yeah, they play a huge role in keeping it top of mind for everyone.
Now, even with great leadership and systems in place, we can't forget about the most important piece, the patient.
That's right.
So what did this study have to say about patient participation?
Well, they found that patient participation is absolutely essential.
Right.
It's not just about telling patients what to do. It's about getting them involved in the process, making them active participants and keeping themselves safe.
So instead of just saying, don't get out of bed without help, we might say something like, here's what we know about your risks, and here are some things we can do together to keep you safe.
Exactly, yeah. It's about working with them, not just dictating to them.
Right. It's about shifting from that old kind of like paternalistic approach to a more collaborative one.
Exactly.
And I think that's where communication becomes so important.
Oh, absolutely.
Like how we talk to patients about fall prevention can really make a difference in how willing they are to participate.
Yeah, for sure. And I think that leads us to another really important aspect of patient-centered care.
What's that?
Understanding that there are different levels of patient involvement.
Right.
It's not a one-size-fits-all kind of thing.
It's a spectrum.
It is, yeah.
You know, some patients might be okay with just getting information,
right,
while others might want to be involved in every single decision.
Exactly, and we need to be sensitive to that.
Absolutely. So I guess we'll dive deeper into that in part 2 of this deep dive, along with some practical strategies for empowering patients at every level.
Sounds good.
Awesome. So stay tuned.
Stay tuned. Welcome back. Before the break, we were talking about all those different levels of patient involvement.
Right.
And I think that's a perfect way to start thinking about how we can actually empower patients. Because we know just telling someone, hey, you're at risk of falling, it doesn't always change their behavior.
That's true. We got to meet patients where they are.
Right.
Give them the tools and the knowledge so they can participate in their own safety.
Exactly.
But how do we do that in a way that makes them feel empowered and not controlled?
That's the key. I think one way is to focus on communication.
Okay.
Like clear, concise communication. Instead of just listing off a bunch of rules, explain the why behind the recommendations.
So give me an example.
Sure. So instead of saying, you have to wear these non-slip socks,
right,
we might say, these socks will help you grip the floor better and reduce your risk of slipping.
I see. So it's about emphasizing their well-being.
Exactly.
And giving them a sense of control.
Right. That agency is so important.
And I bet even simple things like explaining why we ask them to use the call button before getting out of bed can make a big difference.
Absolutely. When patients understand why we're recommending something,
they're much more likely to cooperate.
That makes sense. And that kind of brings us back to that continuum of patient involvement.
Right.
So for some patients, just explaining things clearly and answering their questions might be enough to encourage them to really take ownership of their safety.
It might be. For some folks, that's all they need.
Right. But for others, we might need to do a little bit more.
We might.
We were talking earlier about that fall to PS software. That seems like a good example of an intervention.
Yeah, did it?
That actually involves the patients.
Right. It's not just about assessing risk.
Yeah.
It gives patients and their families personalized information and resources.
Oh, wow.
It helps them understand their own specific risk factors.
Okay.
And it gives them strategies to manage those risks.
So it's like giving them a personalized fall prevention toolkit.
Exactly. And that feeling of being an active participant.
Right.
Instead of just, being told what to do. That can really empower them. I love that. But let's be real.
Yeah.
Even with the best communication and the most patient-centered approach, some people are still going to resist.
Oh, they are. Yeah.
So how do we deal with that?
Well, I think the most important thing is to listen.
Okay.
When someone's resisting, our first instinct should be to just listen.
Really listen.
Really listen. Try to understand where they're coming from.
Because sometimes what looks like resistance is actually just fear.
Right.
Or maybe they just don't understand.
Exactly. They might be scared of losing their independence or embarrassed to use a walker, or maybe they just don't think they're really at risk.
So we got to address those underlying emotions.
We do.
And offer reassurance.
Right. And sometimes it's about being flexible.
Okay.
Finding creative solutions.
Give me an example.
Sure. Let's say a patient absolutely refuses to use a walker.
Yeah.
Well, maybe we can look at other options.
Okay.
Like a cane or a bedside commode.
Right, something they're more comfortable with.
Exactly. It's all about finding that balance between keeping them safe and respecting their preferences.
And their dignity.
Exactly.
And I think we also got to remember that families can be huge allies in this.
Oh, absolutely.
We were talking earlier about how families tend to get less involved in those sub-year sessions over time.
Yeah.
So we need to be proactive about keeping them engaged.
Right.
I think that's so important.
It is.
Families can provide support and encouragement and just a familiar face.
Yeah, that can be so reassuring for patients.
For sure. So what are some things we can do to get families more involved?
Well, first of all, we need to make them feel welcome.
Okay.
Like really welcome and valued.
Yeah.
Encourage them to participate in those bedside rounds and the care plan discussions.
And make sure they understand the patient's risks and needs.
Absolutely. We can also give them resources and information on fall prevention strategies.
So like pamphlets and websites.
Yeah, there are some great ones out there.
Right.
That offer practical tips on things like helping with mobility.
Okay.
And creating a safer home environment.
So it's about giving them the knowledge and the confidence to be real partners in their loved one's care.
Exactly.
Now, we've talked a lot about the human element of fall prevention, communication, collaboration, patient and family engagement.
Yeah.
But what about technology?
Okay.
We touched on it a little bit before.
Yeah.
But I'm curious to explore how HIT can help and maybe even hinder our efforts.
It's a tricky one. I think the main thing to remember is that technology should be a tool.
Okay.
It should support us, not replace our clinical judgment.
So it's not about just relying on algorithms and alerts.
Right.
It's about using technology to help us make better decisions.
Exactly. When we use it thoughtfully HIT can be a huge help. For example, it can streamline documentation and make it easier to track those fall risk assessments.
Yeah.
And some systems can even generate alerts for patients who meet certain risk criteria.
So it's like having another set of eyes watching out for falls.
Yeah, kind of like that.
But I'm also thinking about the potential downsides of relying too much on technology.
Oh, yeah, there are definitely some downsides.
Like what?
Well, one of the biggest ones is alert fatigue.
Alert fatigue.
Yeah, if the system is constantly sending us alerts for every little thing, it can be overwhelming.
I can see that.
And we might start ignoring those alerts.
Right, which could mean we miss important opportunities to intervene.
Exactly. So we got to be careful about that.
Yeah.
Make sure we're using technology in a way that helps us makes our jobs harder.
So it's about finding that sweet spot where technology makes us better at providing safe and effective care.
And patient-centered care, of course.
Of course.
That's the goal.
Absolutely. And I think that's a good place to pause for now.
Okay.
We've talked about so much in this deep dive.
We have.
From understanding all those complex factors that lead to falls to building a culture of prevention.
Right.
And then finally, how to manage falls when they do happen.
Well, we've covered a lot.
We've really explored the whole spectrum of fall prevention and management.
We have.
And we've focused on practical strategies that you can actually use in your everyday work.
Hopefully people will find this useful.
I think so. And the main message, I think, is that it's a team effort.
Oh, yeah.
Everyone's got to be involved.
Absolutely.
From the nurses to the doctors to the therapists and the families.
Everyone plays a part.
Everyone. It takes a village to keep patients safe.
Couldn't have said it better myself.
And you know what? We've really only scratched the surface here.
We have.
So we encourage you to check out those research articles we talked about.
Yeah.
You can find links to them in the description.
Happy learning.
All right, until next time, stay curious and keep diving deep. Welcome back. We've spent a lot of time in this deep dive talking about how to prevent falls in hospitalized older adults.
Yeah, we've talked about assessments and interventions and building that culture of prevention.
But as we know, even when we do our best, falls can still happen.
They do.
So let's talk about what happens after a fall.
Okay, that's a really important topic.
It is. Post-fall management is key.
It is not just for the patient's well-being right then, but also for preventing more falls in the future.
So let's say a patient has fallen. What's the first thing we do?
Well, the very first thing is making sure the patient is safe.
Of course.
And stable.
Okay.
We got to assess for any injuries. And if they need immediate medical attention, we got to get that for them right away.
Absolutely. So once we know the patient is okay medically, what's next?
Then we need to do a thorough post-fall assessment.
Okay.
And this is more than just checking for bruises.
Yeah.
It's about figuring out why the fall happened.
So we can stop it from happening again.
Exactly. It's like being a detective.
I like that.
You got to look for clues.
Okay, so where do we start?
Well, we got to consider all the things that could have contributed to the fall. So that means looking at their medical history, their medications, any recent changes in their condition.
So like if they started a new medication that makes them dizzy?
Exactly. That would be a big red flag.
Yeah.
We also need to look at their surroundings.
Okay.
See if there were any hazards that might have played a role.
Like a wet floor or something?
Yeah, a wet floor, poor lighting.
Okay.
Even clutter in their room.
Oh, right. That makes sense.
And don't forget about their shoes.
Oh, yeah.
Were they wearing non-slip shoes?
So it's about looking at the whole picture.
Exactly.
Okay, so we've checked the patient, their medical history, their meds, their environment. What do we do with all that info?
We use it to make a new care plan.
Okay.
That addresses all those risk factors.
Okay.
And includes specific things to prevent future falls.
So, like, if we find out that a new medication was a problem, maybe we adjust the dose.
Right. We could do that, yeah.
Or switch to a different medication.
Exactly. Or if we found some environmental hazards, fix those right away.
Of course. And I think this is where communication is so important.
Oh, absolutely.
We got to make sure the patient understands the new plan. And their family and the whole care team.
Everyone needs to be on the same page.
Everyone working together to keep that patient safe.
Exactly.
And of course, we got to document everything.
Yes, good documentation is crucial.
So we have a record for the future.
Right, and so we can track any patterns or recurring problems.
But it's not just about documentation, is it?
No, it's not.
It's an ongoing process.
It is. We have to keep reassessing the patient's risk.
Okay.
And make changes to the care plan as needed.
And just always be on the lookout for any changes in the patient's condition that could increase their risk.
Exactly. We got to stay proactive.
See, one step ahead.
Exactly.
And now, I want to go back to something we talked about before. Gait speed. That potential sixth vital sign.
Right.
Even if we don't have all the fancy gait analysis equipment, we can still just observe how the patient walks.
Oh, absolutely. Just paying attention to how they walk can tell us a lot about their risk.
So like if they're shuffling their feet or struggling to turn.
Yeah, or if they're losing their balance.
Those are red flags.
Big red flags.
That we need to investigate further.
Exactly. And that might lead to things like physical therapy or assistive devices like a walker or a cane.
Right. So the key takeaway is don't underestimate the power of just observing.
Oh, I agree.
And using your clinical judgment.
Right. Sometimes the most important information is right there in front of us.
We just got to know what to look for.
Exactly.
Well, I think we've covered a lot today.
We have. We've gone from the basics of falls to building a culture of prevention and how to manage falls when they happen.
We've really explored the whole spectrum of fall prevention and management. And I think the most important thing we've learned is...
What's that?
It's a team effort.
It is.
Everyone plays a vital role.
Absolutely.
In keeping our patients safe.
Nurses, doctors, therapists, families.
Everyone.
Everyone.
And remember, we've just scratched the surface here.
We have.
So we encourage you to dive deeper into those research articles we discussed.
Yeah, definitely check those out.
You can find links to them in the description below.
Happy learning.
Until next time, stay curious and keep diving deep.